Hello, everybody. I'm Dr. Robert Johnson, and I'm the Dean of the Rutgers, New Jersey Medical School, interim Dean of the Rutgers Robert Johnson Medical School, and I've been practicing medicine at the medical school for almost 50 years. One of the other things I've done that's a very important part of my life is that I've been a physician who worked at the door. In fact, I was one of the persons who was there at the beginning. And so it's been a very, very long time. I am chair of the medical board at the door, and it's been a very important part of my life.
My name is Fadwa Youssef. I am on my second year of college studying behavioral neuroscience. I'm also a senior youth council member at the door. Most of my work at the door mirrors my career aspirations, which is to help others cope with and heal from the effects of social injustice and structural inequality. A lot of that has to do with preventative work, as well as changing our conditions so that no one should have to heal from the trauma of something like homelessness in the first place. That's why I'm excited to talk to Dr. Bob today, because really, what's a better preventative measure than a vaccine?
Hello, my name is Malcolm Callender, and I'm a new member of the Youth Council here at the door, simply looking to make a difference in my community and inspire lots of minds, all the while studying at Rutgers University. I want to start today's conversation by simply asking, why did you decide to get the vaccine?
Well, as you know, I'm a physician and I treat many patients who have COVID, and I've seen how bad this disease is. I was very, very happy when a vaccine was made available. And I'm in one of the risk groups. I'm over 70 years old. I'm 74 years old, and I actually have contact with people who have COVID almost every day. And so the vaccine is something that's going to protect me and my family and actually my patients. And so when it was available, I was at the front of the line ready to get it.
So, how does the vaccine work?
Well, that's a very good question because most people are used to vaccines that work because they give you a little bit of the disease, and they give you a part of the germ that's either like attenuated, cut off, or inactivated, and then the body reacts to that a little bit of the disease, and in doing that, it produces antibodies or protection for it. The two vaccines that are out now, the one from Moderna and the one from Pfizer, are different. What happens is that what you get when you get the vaccine is a little piece of protein is called messenger RNA. That messenger RNA instructs the body to produce a particle that allows you to produce antibodies to the disease. And you do that without getting the disease at all. So you don't have to put any of the virus in your body in order to produce these vaccines, produce these antibodies. That's very exciting because this same method can be used with other diseases as well, and we very well may see in the coming years that we'll have new vaccines. Now, some people are concerned about that. They say, well, how did we do this so suddenly? We didn't know anything about it. Well, actually, this technology has been around for quite a while, so at least since 2013, when it was developed in conjunction with the Ebola epidemic. So that's how it works. It is a very good method, and one that, as we see as a result of the clinical trials, is very, very effective.
What exactly did getting the vaccine feel like?
Well, all of us have had vaccines before. Every year I get a flu shot, and everyone should get a flu shot. And I think many of the young people who are listening have gotten shots when they were younger and even later on. So it feels just like that. It's a small needle, goes into the arm, into one of the muscles in the upper arm, and that's about it. It's nothing really special. I was asked to wait 15 minutes afterwards just to make sure I had no reaction, since this is something new. I did not. And so it actually felt a little liberating knowing that I was finally getting some level of protection.
When you got the vaccine, did you experience any side effects?
None whatsoever. I had it right, well, this arm for one and that arm for the other one. And I felt the needle go in. It was actually no different than the flu shot. And I had none at all. Now, some people may have side effects, and I think but the side effects are usually very, very minor. Some people have some muscle aches and pains. Other people will have a little bit of a fever. But that's about it. And most of the people I know who've had it had zero effects, but there's some people may have some. Believe me, it's a lot better than getting COVID-19, and it lasts for a very short period of time.
How does being fully vaccinated against COVID-19 feel?
Well, I've had my second shot now with the two vaccines that are out now, the Moderna and the Pfizer. You do have to have a second shot. So I've had my second shot.
Mhm.
It's now been a length of time that that's passed that should place me at something like 96% protected. And so I don't feel like Superman, but I know when I'm seeing patients who have COVID, and in fact, I saw a few yesterday, I'm a little bit less worried. Although one of the things that's very important, I still wear a mask, I still socially distance, I still wash my hands. You have to continue to do that, but it feels really good. It feels good also to know that after a very, very bad year, we're finally turning the corner and going back to a time when things may be a whole lot better.
What would you say to people who are just really worried about the vaccine and how rushed the approval process is?
Well, I can understand that people are concerned about how quickly we did this. Now, we were in the middle of a pandemic and people were dying at a very high rate. And so we were looking to do everything we could to get drugs and preventions out quickly. And usually what happens with a vaccine is you develop the vaccine and then you spend months with the approval process before it ever goes out to the public. And so what you see the pharmaceutical companies doing now is obtaining something called an emergency use authorization. And that is a speeded up approval. Doesn't mean it's any less safe. We do all the testing prior to ever getting to that point to make sure it's safe and effective. But we go through the process much more quickly so we can begin to have some response to it. So that's what's happened. The technology, the science that's been used to develop it is not really rapid, and it's not a process that's been developed with any um, cuts being done to that would prevent anything from being safe. And the other thing to look at is that since the vaccines have been available, since in this country since December, 32 million people have been vaccinated at least one time. And we haven't seen a lot of people having a problem. And so that alone should tell everyone that it's something that is safe to do.
With a lot of nerves going through many people, I want to know, how can I be sure that the vaccine is safe?
Right. Well, there's been a lot of discussion about the first two vaccines that have been available, one from Moderna and one from Pfizer. They are both based on what's called a messenger RNA platform, which is different than the typical vaccines that all of us have experience with in the past. However, these are not new. This technology was actually developed back when the Ebola epidemic was occurring in the world back in 2013. And there's been a lot of research based on this platform. And actually this platform, which is the method that it's used to be delivered, may be something we use in the future for maybe even diseases like HIV. So the vaccine technology has been around for a long time. Before it's ever approved for use by the FDA and the CDC, there are thousands of people who have taken it in clinical trials just to make sure that it's safe in all populations to understand how it works in the human body. And to date, there are approximately 32 million people in the United States who've had the vaccine, at least one of the doses of this one product. And so it's just as safe as just about any other vaccine. And it's something that everyone can rely on.
Why should elders in our community get the vaccine?
One of the things we discovered at the beginning of the pandemic was that there were certain groups of people who were at greater risk for bad outcomes, either death or very serious illness, or even complications that last for a long period of time. And the persons who were at greatest risk were people who were elderly, individuals who were over 70 or 75. That's also true for people who had respiratory illnesses, people who have diabetes, people who are obese, people who smoke cigarettes, a whole variety of people who are at greater risk. And so the decision was made when the vaccines became available, that we should give the vaccine to those persons who are at greatest risk first. Now, another group of people who are at great risk are healthcare workers. And so people, not only doctors and nurses, but anyone who works in hospitals and has contact with people who have COVID-19, to treat them. And so that's one of the reasons why in most states, those individuals receive the vaccine first as well. So that's a good public health approach to identify people who are at greatest risk and then make sure that we vaccinate them first. In some states, you're seeing now that restaurant workers, cab drivers, police, teachers, a whole variety of individuals are moving into the category where they should be vaccinated. However, eventually, everybody needs to receive the vaccine. Everybody. And so, and that's going to happen as more and more vaccine platforms roll out.
As we work towards that goal of everybody someday getting the vaccine, what do you think are some good ways to encourage older adults we know to get the vaccine?
Well, there's not much more you can do more than the fact that we have almost 500,000 people who've died from this illness so far, and people are still dying and still getting the disease now. Some people are concerned because they're fearful that the vaccine is not safe. Well, we are 32 million people throughout this country alone who've received the vaccine. So it's safe to do. The disease is deadly. The disease is still here. And everybody is at risk of having a bad outcome from this disease if they get it. And the vaccine will protect you from getting infected. It's clear that this is what needs to be done. Now, I understand that there are people who mistrust science, and mistrust, especially in my community, in the African American community. There are people who look and see that about experimentation that's been done with our people, and they mistrust what things that may have gone on before. But that's not, that should not stop people from making a sound, positive health decision.
How should people learn more about getting the vaccine in general?
Very important question. And of course, that there's lots of stuff on the internet, and you can find on TikTok or Twitter or Instagram all sorts of things that are not true. The thing to do that will give you the best information is go to the CDC website. If not the CDC website, the websites for the Department of Health, either in New York, New York City, whatever state, but the CDC, the Centers for Disease Control, has all the best information. And they provide information for the public, and you can rely on that information. And it helps you cut through all the rumors and the false information that is flying all over the web.
I haven't got the vaccine, but after this discussion, it's definitely something that I want to pursue. What are the steps to go about that?
We talked already about who's getting the vaccine, and in all states, what is happening first is people who are at greatest risk of receiving the vaccine. So it's the elderly and people who are in healthcare workers. And we're moving on to other populations as well. And it's tied mostly to what your risk group is. And so with young adults, you're most likely at the lowest risk group. And so you will not be eligible for the vaccine until the other populations have been vaccinated. Now, the thing that may make that different is if you are a young adult and you have a risk. If you have asthma, if you have diabetes, if you smoke cigarettes, then you may fall into a category where you can get the vaccine early. The other thing that's important is that the vaccine is not yet approved for children and youth. And that's simply because the clinical trials to show us that it's safe and effective for children and youth have not been completed yet. It should be very soon. And once those are, then we will go about vaccinating children and individuals who are under 16 or 18 years of age.
Why should young people get the vaccine when it's available to them?
Well, one of the things we need to do is to have just about everybody in the country take the vaccine to achieve what we call herd immunity. And once that happens, then we can go back to closer to a normal period of life. And so that will then allow people not to get it and pass it on to somebody else. So we need to have at least 70 to 80% of people in the country vaccinated in order for that to be achieved. Now, young people, young adults and adolescents are not eligible yet to receive the vaccine. It's approved for above 18 or 16, depending on which vaccine that's out. And so you won't be able to get it if you're a child or an adolescent. That will change soon because the clinical trials are now including children and youth. And once that happens, then probably in the early summer, we'll be giving it to them.
I know a lot of female youth in contact with the door who are pregnant. What would I say to young mothers about getting the vaccine?
So I get that question a lot, that general type of question, if I have one condition, does that make me at greater risk for getting the vaccine? The answer is absolutely no, it does not. Pregnancy does not make you a greater risk of having a reaction to the vaccine, and pregnancy and the vaccine does not put the developing fetus at risk as well. So that if you are pregnant and if you fall into a category where you can receive the vaccine, you should receive the vaccine. Now, as it turns out, right now, since we're focusing on the elderly, there are not going to be too many elderly who are pregnant. But if you, for example, are a young person who has asthma or diabetes and you're pregnant, absolutely, you should get the vaccine when you can.
We've heard about in the news about how there have been new strains of COVID. What does that mean for the vaccine?
That's a very important question. And one of the things that's characteristic of viruses is that when they replicate, when they reproduce, they change their genetic structure. And when they do that, they're likely to produce a component that may give them some resistance to either a drug or to a vaccine. And we call these the variants. And so right now, there is one variant that's called the UK variant. There are actually two of those. There's a South African variant. There's a Brazilian variant. There is a variant called the Southern California variant. And they're probably all over the country. Now, what this may mean is that the vaccines may be less effective. Right now, we really don't know. And one of the things we have to do is keep up with vaccine technology so we can change the vaccines if the variants take hold. And actually, we're doing that with some of the vaccines. The other thing that's important is, and I said earlier, the way vaccines develop variants is they replicate. So if they get into a body and they reproduce and are passed on, then they produce variants. So if we decrease replication, and that was achieved when there's herd immunity, then we'll prevent having this problem. And so one of the things we have to do is get people vaccinated as quickly as possible so we can decrease the chances for variants being produced. The other thing that may happen as a result of this is we may need to get booster shots. And, with a flu vaccine, for example, we give a new flu shot every year. That's because the flu virus is one that changes a lot. And so we have to develop a new vaccine for the flu every year. So we'll just have to see what happens if that goes on. But it's a very important aspect of what's going on right now.